You know, there are a lot of things that we've started doing online since the COVID-19 pandemic. Kids know the ins and outs of virtual learning, right? More people are turning to jobs where they can work from home. There we are. Okay. And you can receive medical care from your phone or your computer. But many people don't understand how or when to use virtual care. And with the holidays coming up, traveling, all of that, we want you to know what to do. So we have Cone Health nurse practitioner Hannah Mills here to talk about virtual care and answering common questions for your well-being. First off, all right, let's talk about what type of healthcare appointments can we actually do virtually?
So you can do a lot of appointments virtually. This is the silver lining of COVID. We are now in an age where we can see people like me and you are talking just like this without them having to come a step out of their door. So the type of appointments that we're seeing right now, especially with the flu season, are the respiratory viruses. We're seeing a lot of common colds, flu, COVID, but that's not all that we can see. We can see you if you have pink eye, if you have a rash, if you have gout. There's a lot of primary care that we can see virtually as long as it's done in a safe manner. The things that we don't really want you to make an appointment for are chest pain or if you're bleeding. Please go to an emergency room or be seen in person for emergencies like that.
Okay, got chest pain, got bleeding, go straight to the emergency room. But everything else, you could possibly make an appointment. All right, so a lot of folks would say, well, I don't have, a home computer. All I have is a phone. Is that possible?
Yeah. So the beauty of having virtual care and technology in this day and age is that it's everywhere. You don't have to have a computer. You just have to have access to the internet. That could be your iPad, that could be your smartphone, that could be a tablet. Any device that connects you to the internet can connect you to us or any virtual care service.
All right, and so what ages is this best for?
So when you go onto our virtual site, we can see ages 2 and up, depending on what type of appointment you make.
Okay, and is the provider on the other end a Cone Health provider or is it someone else?
Yeah, so all appointments made with Cone MyChart will connect you with a Cone Health provider that is board certified medical personnel.
Okay, and so, sometimes we use words interchangeably and maybe they're not meant to be used that way. What's the difference between virtual care and an e-visit?
So an e-visit is virtual care. There's two avenues for virtual care visits right now. One is like this. Me and you are talking, we're on the camera, I can see you, you can see me, and I can tell exactly what's going on with you a little bit. If you're breathing okay, if you're having a rash that I can see up close. The e-visit is a little bit different. It's still virtual, but it's a questionnaire. And it gives you 42 different diagnoses or symptoms. So if you have a cough, you're going to click on cough and you're going to go through these questions. Then that's going to go to our providers. Our providers are going to read through that. They're going to pick the diagnosis that fits that, even if it's not cough. They're going to send it back to you with an explanation of what's going on. It's going to give you whether or not you're going to have medicines and what pharmacy they'll go to based off of the information you've provided. It's a lot like email. You send me something, I send you something. It goes to the email that's connected to your MyChart. The only thing about e-visits is that you got to remember you're not going to talk to a person like me and you are talking right now. And sometimes that can be a little confusing. If you had a rash, we might have you upload a photo, but that's as far as that part goes.
Okay, so if you really think it's something that you need to talk one-on-one with, that you need that person to hear you, to see something, that kind of stuff, you really need to do the virtual visit.
Yes, we definitely prefer that. And if you have more than one issue going on, the e-visits kind of direct just one type of thing. So if you had like pink eye, we can direct that. But if you had a cough or cold and all of a sudden you have pink eye, you've got a couple of things. Let's do a virtual camera to camera so that we can see what's going on.
Right, and so maybe the e-visit is also better for something that you've had this before kind of thing. So you already know the symptoms and you're like, that's not necessary
Right.
for me to talk to the doctor. Okay, now for
There
someone who
you
says, hey, you know what, I'm just not tech savvy enough to use virtual care, what do you say?
Well, I'm right there with you sometimes. That's one of those things. It happens, but don't let that ever stop you from getting the care you need virtually. So we have worked really hard to make our visits very user friendly. The MyChart site guides you through step-by-step process, which is awesome. It is super nice to use. The other thing is, I would suggest if you have somebody that you trust, a family member, a friend, or somebody, a coworker, that you're like, hey, could you help me make sure I'm doing this right? That's fine with us. We're okay with that if you're okay with that because it's your medical information. But after you do that, that's fine. If you have any problems, you're logged on and you're talking or you can't hear me, like if we were communicating right now and all of a sudden the sound went out, that's all right. We all have technical issues. We don't want that to prevent you from getting care. Our promise to you is that we're right here with you and we will pick up that phone and we will get on the phone with you and we will connect you with whoever you need to be connected with, me or somebody else, and we'll get you the care that you need.
We are back with Cone Health nurse practitioner Hannah Mills to talk about all things virtual care. And we've thrown this around a few times. Go to My Chart. Just go on to My Chart. So some people might be like, I don't know what My Chart is.
Yes, so My Chart is your patient portal to Cone Health. So if you go to a Cone Health office, you can have a patient portal that you can communicate with your providers or the nurses and the staff, see your results. And this is what allows you to have the virtual appointments.
All right, and this is super handy because you can go, like if you've had a physical or something done, you can actually see all of your blood work and stuff like that before, you know, the office would even be able to call you. So, I mean, it really is a good resource and you can talk to your doctor back and forth. All right, so let's talk about how virtual care can help out, especially when we're traveling for the holidays.
So virtual care is a wonderful option if you're traveling for the holidays. It's great to do if you're, going out of town to see some family, you started feeling bad, or you thought you got exposed to the flu. Hop on, get a visit, and we'll get you taken care of.
All right, but what about if you're traveling outside of North Carolina? Can you still use this?
So yeah, we can certainly see you. Our one thing is that it's a national thing. Every provider has to be licensed in the state in which they prescribe medicine. So if you're not in North Carolina and you see a North Carolina provider, then you won't be able to be prescribed medicines, but we can kind of help you work out what's going on and direct you where you might need to go if it's an emergency.
Okay, so with flu, RSV, COVID in our community, some people may not want to go in for health care. So this would definitely be an answer to that instead of just skipping health care.
Oh, most definitely. Stay in your pajamas and stay at home. Be comfortable. So you can make a virtual care visit. It's a great option to do, especially when you want to avoid it, giving it, and avoid, receiving it. So yeah, any flu or like virus related illness, stay at home, be comfortable, sit on the couch. We don't mind what if you're comfortable, we don't mind. So just hop on, make an appointment, and we're glad to see you. And we'll tell you if you need that in-person evaluation, we'll direct you where you need to go.
All right. Now, what about this? What about if you see the doctor and then the next time you're supposed to like follow up like in a week or 2 weeks or something like that, can you make a virtual visit instead of going back into the office?
Yeah, so all of our co-medical group practices offer virtual care options. So if we say, hey, follow up with your primary care provider, it's easy in a safe way as long as your primary care provider feels that that is appropriate. So we don't ever want to over succeed your provider. So if they think that it's appropriate, then most certainly you definitely can do this virtually.
Okay, so as long as they think that it's safe for you to do that, I
Right.
understand.
Yeah,
so how much does the virtual care cost, and then how do you pay for it?
So we are billed like primary care appointments. Usually you have your primary care copay with us, but it does depend on your type of insurance. I would always say it's a good idea to contact your company prior to making a virtual appointment to make sure that you know what kind of coverage you're looking at. And then I can tell you that our e-visits are $35. Those are the questionnaires that are like an email that go back and forth. Those are $35. But the other appointments of the video appointments, they're billed just like a primary care appointment would be.
Okay, just like you would go in and normally pay your copay. How do you sign up for virtual care with Cone Health?
So we have two great options here. You can go to the website, www.conehealth.com/virtual care, or you can also text FLU, FLU, to 39417.
Okay, let's say that one more time. You can text the word flu to
39417, and that'll text a link back to your phone, and it'll take you to the website that I just said.
Okay, all right, that sounds good. We appreciate your time and your expertise and laying it all out.